Good afternoon, and thank you all for joining the launch webinar for the ASPPH report, Responding to the Climate Change and Health Crisis, a framework for academic public health. My name is Laura Magaña, and I am the President and CEO of the Association of Schools and Programs of Public Health, ASPPH. In our strategic framework 2030, ASPPH set a goal to advance solutions to the critical public health challenges facing society, and we identify climate change as one of those challenges. Recognizing the urgency of addressing climate change and its profound impacts on health, ASPPH convened a Climate Change and Health Task Force. This task force, comprised of prominent faculty from across our member schools and programs of public health, collaborated to develop a framework on climate change and health. The final report, which we will present today, contains both an evidence-based analysis of the status and needs to address climate change in academic public health, as well as a set of recommendations for implementation by the schools and programs, but also with our association, the ASPPH. This webinar is an opportunity to share the framework and discuss some of the topics and challenges it identifies. Before we move into our presentations, I want to remind everybody that you can ask questions in writing at any time during the webinar by clicking on the Q&A button on the bottom of your screen. I'm now delighted to introduce our panelists, and I will start with the two co-chairs of our task force on climate change and health who will present the framework. Dr. Lynn Goldman, the Michael and Lori Milken Dean at the George Washington University Milken Institute School of Public Health, and Dr. Jonathan Samet, Dean of the Colorado School of Public Health. We're also honored to welcome two esteemed colleagues to provide thoughts on the framework and how schools and programs of public health can be part of the efforts to address climate change in our field. Dr. Georges Benjamin, Executive Director of the American Public Health Association, and Dr. John Balbus, Acting Director of the Office of Climate Change and Health Equity at HHS. I'll now turn over the mic to Lynn and John to present the framework. To you.
Thank you so much, Laura, for that introduction of this event. And thanks to all of those who are online with us as participants. I see a number of public health leaders from across the country joining us this afternoon or this morning, depending on where you are. So this is just a summary of the framework that we and our committee developed on behalf of the Association of Schools and Programs of Public Health, responding to the climate change and health crisis. Next slide. So the task force that we appointed had a number of members from both programs and schools of public health. All of these individuals are leaders in public health. Some of them have spent much of their career working on public health. Others are experts in related areas such as global health, such as health justice and environmental health. Next slide. So we developed a framework that his audience is, of course, the association itself. The association has staff. The association does a lot of work to support the public health schools and programs, but also each and every one of the schools and programs of public health across the country. And we view the work in 4 domains, none of which will come as a surprise for all of you in public health. Of course, education and training, research, but also policy and advocacy and practice. And we particularly recognize that all of our programs and schools are in communities, most of which already are experiencing health impacts of climate, and that many of our schools and programs work very closely with. We develop strategies that are applicable to the schools and programs themselves, but also the organization, and in terms of how the organization supports us, but also supports our faculty. And our strategies are time sensitive. Some of them are things that we feel we can do immediately, some in a more intermediate, and others obviously in a long-term time frame. In developing our framework, we realized that there were some cross-cutting issues that are critical. One is the issue of health equity, environmental justice, and social justice, that the most immediate and most serious impacts of climate change on health are focused in communities that traditionally have been adversely affected by environmental justice and social justice issues, if you may, by structural racism and other structural issues that are related to socioeconomic status and other aspects of communities. We also realize that the schools are going to need to work in partnership with many, many organizations. The ASPPH itself is one of many organizations that works in the public health and health space, and that it has partners that need to be a part of this, but also our schools and programs have partners, either with our local or state governments, with non-governmental organizations in our areas and so forth. And last but not least, that this is an area that involves interprofessional and interdisciplinary collaborations that are critical for our success, whether we're working with our schools of medicine or our schools of marine biology or our schools of architecture and urban design, depending on where the school and program is located, what kind of institution we're in. These are critical partnerships. Next slide. So in developing this, we went through a fairly extensive process that involved assembling our task force, dividing them into working groups, and then having the working groups draft kind of first order drafts that were then disseminated and that were used to develop a complete first draft that kind of brought together all of the working group drafts. And then we ran these drafts through review by our entire association, first through our Wednesday brief, which goes to our program directors and deans, but also through our Friday newsletter, which goes to everybody really in the academic public health community. We had a lot of feedback. We were able to integrate that feedback into later versions of the draft, and then we further disseminated it amongst our members. But also at that point, we brought in to play some of the vested partners, such as the climate program at CDC, actually Dr. Balbus, who's online, and his activity in the Assistant Secretary for Health's office, but also the NIEHS and the National Academy of Medicine. And after that, we were able to produce a final draft, which was actually developed, was actually adopted by the ASPPH at our last board meeting. Next slide. So as we have said in our 138 members, that this framework is the beginning of our commitment. It's not, we check the box, we've done this, we've done the job. We realize that the job that lies before us is a very big job. We're required taking numerous steps on behalf of not only the organization, but also each individual member, school, and program. Next slide. So I'm going to turn things over to Dr. Zammit, John, to tell us a little bit more about the framework.
Great. Thank you, Lynn. And what I'm going to do is walk you through the framework. I think Lynn showed you a slide that laid out the structure of what we have done. I think at the outset, I probably don't need to say too much about the urgency of responding to the challenge of climate and health for our schools and for the ASPPH. I think both Laura and Lynn set the stage for this. I think to their comments, I would add our students in public health and our students in other fields are concerned about what we are doing about the complex challenges posed by our changing climate, and of course, looking to their futures and what may happen in the next half century or more I think there are scenarios that are very worrisome for those who are young. So I will say this is a topic that certainly resonates among those who comprise the next generation in public health. Lynn laid out our underlying cross-cutting themes shown here and these 4 central domains where the task force worked. And again, throughout the document, we acknowledge the context of work on climate change in academia across these 4 sectors. If we can go to the next. So, I think, again, from the introduction by Lynn and myself, we have an urgency here, an urgent call for action. And as Lynn showed you, the recommendations are short-term, 1 to 2 years, intermediate term, 5 years, and longer term. And the task force report is structured to indicate things that we can really get started on. So we're not calling for more task force reports. We're calling for action in this document. Next. So this is back to those 3 themes, which were at the bottom as pillars, foundational pillars in the framework, the need to emphasize health equity, environmental justice, and social justice. We know enough already and have enough experience to know that the consequences of climate change for health and well-being will be borne in different ways by different segments of our society. Those with less resources to adapt may find that their resiliency is not always up to the challenge. There are those whose living circumstances pose challenges, perhaps the legacy of structural racism. And then, of course, looking globally, these same issues arise. The action here requires partnerships, and that's emphasized in the report in the sections on practice and on policy and advocacy. And I think a really important point is the need for engagement of our schools and programs of public health with colleagues at their campuses or at other institutions who bring expertise, perhaps in climate sciences and atmospheric sciences, or in engineering. I think we are not going to find within sort of usual schools of public health and programs all of the disciplines that may be needed to both do research and to search for solutions. So next, I'm going to run through the 4 areas, and in each leading up to the recommendations, the task force sketched out foundational issues and what the needs are. And then, of course, the recommendations are to come. So in education and training, and again, I think many of us are now looking at how to have a curriculum that addresses climate change and health, whether that's starting courses or perhaps degree programs. But these responses are getting underway. And as indicated here, we need to match what our students are looking for. There are roles in terms of addressing the needs for both ASPPH and the individual schools and programs, sharing curricula, having ASPPH become a critical focal point for sharing materials and perhaps bringing together groups to address what the educational needs are and what are the broad set of competencies we want to build in those who will pursue a career addressing climate and health. And there's no doubt, of course, that context is important. There is a research agenda to be met here, if we can go to the next. And again, here we lay out the foundational issues, the need to develop on a sufficiently rapid basis the scientific evidence that is needed to make sure that the right actions are taken to provide evidence that will push on the right policy levers. And this is a complex task, and we are all hopeful, of course, that there will be more research funding available to fill the many gaps. And looking to the right in terms of the needs, I think we'll need to do work within our schools and programs to put together the right teams to take on the challenges of climate and health. We'll need to share resources, designs, and think about what methodologies may be important. Could I have the next, please? Practice. Again, this is an area for application. We know that we, as schools and programs, work at multiple levels, including locally with our states, nationally, and internationally. We have a basis for getting going in terms of practice. We know that we need to be partnered with affected communities to search for solutions that will work at the local level. So looking at the needs that, of course, match in a complementary way the foundation, you can see that we have much to do. We have some tools like risk assessments, scenario modeling, and others that should be useful in this domain to develop evidence and other information that will be useful for decision making. And finally, the next onto policy and advocacy. We think this is a time when the public health significance of climate change has been recognized. We could all list out many examples that have affected us and our communities, have affected our institutions, and I think the consensus has been reached, and we don't need to argue about whether we should do something. We know that there is that imperative, and it's a relatively urgent one. So in terms of the needs, again, we need to find what it is that we can do to summarize that will make a difference, and whether that's with local partners or nationally. And again, here through the collective, the ability to sort of harness our collectives through the ASPPH, we should have an opportunity to reach nationally and internationally. Next. We have principles that have been adopted by the task force that underlie our thinking about what the recommendations should be. We recognize that across the members of ASPPH, there's a broad range of science, different strengths, different gaps, and we don't propose in the task force report that there's one size fits all, but we hope that this will be a venture where ASPPH brings things together for the schools and programs, that it is an important voice for interacting with what will be critical partners in making a difference. So these themes extend through the recommendations. If I can have the next. So this is just simply an example, and the recommendations are laid out under the domain areas and provide and are based on the timeframes that we mentioned, and also the domains, and then are directed at either ASPPH or the member organization. So I think we hope that this organizational structure will facilitate implementation. The next. And, in terms of implementation and strategies, the right words are here on this slide. We know what we have to do. This is not the first time that we have implemented programs, initiatives to advance public health, and we know we have a lot to do to move the task force report forward. So with that, Lynn, I'll turn things back to you.
Thank you so much, John. That was a wonderful overview of our recommendations, and let's go ahead and talk about how we're going to move things forward. So the statement of commitment, I think, is important, that we are committed to promoting and contributing evidence, best practices, and expert guidance that addresses climate change and health within the U.S. regional and global public health systems. We as academicians who are leaders in public health do place an emphasis on evidence and on the practices that we promote being based on science, on the use of experts to provide guidance around that. Advocating for policies that advance urgent action on climate change and health, especially those addressing environmental justice. I think, as Dr. Sim already mentioned, it's important to us that such policies are well-founded, that such policies are also, based on evidence and are focused, targeted toward the issues where we can make the greatest difference in terms of not only preventing climate change, but also mitigating the worst effects on health of climate change. Fostering models for interdisciplinary engagement, not only amongst our entire discipline, but also for our individual programs in schools. We hope to be able to, in our annual meetings, for example, showcase examples of models that are working very well to inspire programs in schools to develop such models themselves. Developing resources to educate and train public health students and professionals in climate change and health issues. Our association has already begun the process of doing that, is already helping to provide such resources. And we're also aware of resources that are coming from federal agencies such as the CDC, the NIH, that are incredibly helpful, enabling our members to make a commitment to implement the recommendations of the framework. As we mentioned before, this is not just a short-term issue, it's also an issue that we're going to be committed to over the long term and the midterm as well. And then championing social and environmental justice, that is focusing on practices, policies, engagements that address climate change health impacts equitably. Next slide. So many strategies and activities. This webinar being one of many efforts that we're going to make to disseminate this report, make sure that people are aware of it. I noticed that the link to the report was placed in the chat, where you can download the entire thing, make use of it to the extent possible. No pride of authorship here. We do appreciate that the report is cited when you use it, but certainly that we want to see the dissemination occur. Engagement, communication, partnerships, and then that we monitor and evaluate this process and make sure that our efforts are actually effective. Next slide. So we do have a social media presence that's very strong, especially there's an advocacy component of ASPPH, and this just is some examples of some of the material that has already been developed by the ASPPH and put forward on social media. And I think any effort that we make as an organization, obviously the extent to which members, faculty members, other people who are concerned about climate and health amplify this information, that's very important, as well as making sure that we're aware of any efforts that your organizations, other organizations are doing, and have the opportunity also to amplify on those efforts. Next slide. There are many resources, and I think that you could probably screenshot this slide. These are all on our advocacy / climate change health website, but not only the report itself and the executive summary, but the public health education toolkit that the ASPPH has already developed, and we hope to see more toolkits come forward from this effort. Next slide. So please stay tuned. I think that you should see and more materials appearing on the ASPPH website, more activities occurring. We will be making a brief presentation about this effort at the APHA annual meeting. Any of you online, if there are other meetings that you are hosting or that you're aware of where you'd like to see the ASPPH have a presence there about this issue, I think we would be really pleased to be able to step forward. I say we, with realizing that that might mean the staff of the ASPPH doing that, but there is a real commitment to disseminating, to communicating about this as much as possible. So thank you very much.
Thank you so much, Dean Goldman, Dean Summit, for this very detailed presentation. So before we go to hear the remarks from Dr. Georges Benjamin and Dr. John Bubbles, please, I encourage all of you to send your questions, because after the remarks of both of them, we will go to hopefully a very engaging conversation with all of you and all our presenters. So with that, Dr. Benjamin, to you.
Hi, thank you, Dr. Magna. You know, it's very clear that climate change is impacting our health today. We see that with the wildfires, with the hurricanes, with the flooding we've had throughout our nation, with the growth in infectious diseases that we're continuing to see. And yet, climate change in health as an academic endeavor has not gotten the academic urgency that it deserves. And in fact, this report by ASPPH is an extremely important catalyst to moving that agenda forward. The research here is sparse. As you see in the report, it shows that there are less than 500 PubMed validated papers in the literature. And we all know, you know, as much as we love to study things, that's really a minimalist approach to such a profound societal problem. And yet, we have enormous opportunities, particularly between the academic community and the public health practice community, to bring together our collective wisdom and then across sectors to address this problem. You know, the CDC has put out a framework called the BRACE framework, which APHA, we've been actively promoting. And that framework looks at anticipating the climate impacts and assessing vulnerabilities as a part of the effort to build resilient communities, looking at predicting the disease burden, looking at assessing various public health interventions through evaluations once those interventions have been implemented, and developing and implementing adaptation plans to help communities adapt to issues around climate change. And of course, doing fundamental evaluation of these overall efforts. All of these things are things where the schools and programs of public health can provide important intellectual engagement, resources, partnerships to make that happen, both by helping to prepare the field through education, by getting together with their state and local health departments on the governmental side to provide those resources to them. And the idea, of course, is to try to make this a kitchen table issue for all of us that are practicing in public health. So I think that the American Public Health Association has very much been interested in this for some time. I encourage you to also look at our website at apha.org. We have a Climate Change and Health Equity Center, where we also have additional resources. And we look forward to seeing you at the American Public Health Association meeting in about a week and a half. And hopefully those of you who are going to be there can attend the ASPPH session to get more details around this very, very important report and this very, very important effort in which APHA is proud to partner with ASPPH. Laura, I'll take it back to you.
Wonderful. Thank you so much, Dr. Benjamin. And I think that later in our Q&A, I would like to really hear like what are going to be the synergies between all of us and the people in the public here in order to really move with more impact together. But before that, Dr. Balbus, to you.
Great. Thank you so much, Dr. Magana, for the invitation to be here today, and to the colleagues with the ASPPH. My name is Sean Balbus. I'm the Acting Director of the Department of Health and Human Services Office of Climate Change and Health Equity. And of course, the Association of Schools and Programs of Public Health is a critical partner in my office's mission to protect the health of people in the United States from the impacts of climate change, especially protecting those most vulnerable. The framework announced today articulates the roles that academic public health institutions can play and, as we said, in fact, must lean into more in coordination with the government, with the private sector, grassroots organizations, other stakeholders to help the nation address the climate crisis. Notably, I love the circular diagram that places education and training, research, practice, policy, and advocacy in a circle that's bounded by justice, collaboration, and partnerships for impact. This framing resonates very strongly with our office and is a wonderful contribution from ASPPH to the broader effort to place social justice and health equity at the heart of our work on climate change resilience. The COVID pandemic has laid bare the role that systemic injustice and degradation of the social determinants of health, including people's built and ambient environments, play in health disparities. The research that's been well supported on COVID showed how chronic exposure to air pollution, which is also well documented to be generally higher among communities of color and low-income populations, was a strong risk factor for dying from COVID infections. Similarly, underlying chronic conditions like diabetes, obesity, asthma, hypertension, which are also disproportionately higher in communities of color and indigenous communities, are also contributed to by degraded built and natural environments. These were also strong risk factors for bad outcomes from COVID. These very same factors that have resulted in disproportionate illness and death in communities of color and indigenous American communities and people experiencing poverty and low income are clearly also at play in the disparate incomes we see now from climate-related health threats, whether that's heat waves, wildfire, smoke inhalation, extreme storms, flooding. I'm just going to say it again. The same factors that cause death from COVID are causing death from climate change-related health threats. So the task that lays before us is integrating the work that's underway and relatively well supported to address some social determinants of health in response to the COVID experience, and integrate this with the work just getting going to enhance the resilience of communities in the face of the climate crisis. This is one important aspect of the health landscape that this framework is being launched into. From my vantage point within HHS, I see laudable focus and laudable emphasis on addressing social determinants of health and upstream drivers and injustices as a way to redress health disparities. And very importantly, I think this is opening a door to renewed and deeper partnership between healthcare and public health, as healthcare delivery systems begin to pay more attention to making interventions in people's living conditions, which of course relies on research evidence and practices that come from public health. This is a welcome broadening of the focus of the health sector, but unfortunately, for the most part, the importance of addressing environmental and climate stressors is missing. While natural and built environment are always on the official lists of social determinants of health, they are hardly ever addressed in an operational way. Whether we're talking about the Z codes that have been created for reimbursement purposes for interventions, or just the nature of the screening questions and data being developed to understand individual patients' needs. The framework notes a similar lack of emphasis of the central importance of natural and built environments for people's health, for example, in the revisions to the Council on Education for Public Health accreditation criteria and the articulation of the foundational competencies. So this presents a challenge, but I think also a powerful opportunity for public health, especially those aspects of public health schools and programs that bridge between public health and healthcare delivery, to better integrate a holistic and comprehensive approach to improving people's environments and living conditions into the efforts to reduce health disparities in the healthcare delivery sector. And the first steps are going to be the education and training of public health students and professionals, and the communication and cross-training of these issues to the healthcare delivery sector and the general public. I want to just shift now, with a little bit of time I have left, to talk about our office and how we look forward to collaborations with the Association of Schools and Programs of Public Health in implementing this framework. Simply put, Department of Health and Human Services' mission to enhance the health and well-being of all Americans cannot be met without addressing climate change. We're working hard to achieve our vision of a nation where everyone, especially those most vulnerable, is protected from the health impacts of climate change. And for us, this also means a health sector that's prepared to operate in the midst of ever-increasing climate-related health threats And that has also needs to drastically reduce its own greenhouse gas emissions in line with the Biden administration's economy-wide goals of 50% by 2030, net zero by 2050. We've made good progress in the last year. To start, we joined the COP26 health program, committing to building climate resilience in health systems and decarbonizing our health sector. We're working closely with federal health systems to do this, like the Veterans Health Administration, the Defense Health Agency, the Indian Health Service. And through the White House and HHS Health Sector Climate Pledge, we've also invited private sector leaders to join federal health systems on this journey. Our Office of Climate Change and Health Equity is continually rolling out new supports and information on accessing federal assistance to help our private sector partners. But as an office at the federal level, we also recognize that the action on climate change resilience has to happen at the state and local level. So we're working closely with our regional offices to hold climate change and health equity summits, to raise and listen to the voices of communities in the regions that are being hardest hit by climate change impacts, and to enhance the coordination of federal resources to address local needs. We're working to bring together the suite of federal resources available to support the public health and healthcare delivery systems. And for example, this year we launched the Climate and Health Outlook. This is a novel product that not only provides, and doing this with many partners across the federal government, we have 11 agencies we're working with. This not only provides a seasonal forecast for health, taking the 30 and 90-day forecast for temperature and precipitation and government's forecast for drought, hurricanes, and wildfires, and interpreting that for the health sector. But it also identifies and puts numbers to the people most vulnerable to these impacts, and then catalogs the various federal resources available to help those people stay safe. So this is a valuable resource, we hope, for the health sector and for local health departments. Hope everybody has had a chance to see it. We're also in the midst of a webinar series describing federal resources available to the health sector, and we're planning many additional outreach and events to help raise awareness, build capacity for action across the public health and healthcare sectors, including a collaboration with the Million Hearts campaign to raise awareness about the cardiovascular health implications of air pollution and climate change, webinars to explore the growing movement to create community-developed resilience hubs to address the intersecting needs for improving social determinants of health and living conditions at the same time as enhancing resilience to weather-related disasters and climate change impacts. These goals to address both healthcare sector decarbonization and community resilience will include ongoing resources related to the Inflation Reduction Act. IRA is truly a landmark piece of legislation, provides substantial resources for climate change action, though I note that the Act does not provide any funding for climate actions to the Department of Health and Human Services. But nonetheless, through tax credits, technical assistance, and tools-based in other agencies, it creates remarkable opportunities for health stakeholders to become much more efficient with their use of energy, and of course for communities to become more resilient. And I think the IRA will provide massive nationwide opportunities for schools of public health to support community partners in accessing those resources. Our office is working closely with the broader federal family to make sure health stakeholders are aware of these opportunities. So in closing, I just want to repeat my congratulations to the association and the authors of this framework for this launch and this accomplishment. Our office stands ready to partner with public health schools and practitioners in our shared goals of protecting the health of everyone in the United States and its territories, especially those most burdened from the health impacts of climate change. Thank you very much.
Wonderful. Thank you very much, all of our presenters. And then we're going to move us to a panel discussion. So we welcome all your questions, and I would like to start with actually the first question, addressing our first question on the chat in this regard. I would like to ask all of you, where do you see the synergies among ourselves? I mean, we have heard that APHA, the government, all the academic schools and programs of public health, and some of our audience here, which that's the question number one, maybe all of us are working under the same common agenda. Where do you see the synergies and the opportunities to work together to really do more impact in and advance our common agenda? So anyone who wants to answer.
One thing that I think is definitely the reality with this issue, whereas probably even 2 years ago, there were a relatively smaller number of people who really spend a lot of time on climate and health. And also, as Dr. Benjamin mentioned, was extraordinarily difficult for academics to get engaged because there basically was no research funding, and there's been very little output as a result of that. However, and this is not the first time I've seen this in my lifetime, we are going through a period now where climate and health is bursting forth as a tremendous effort that is going to be undertaken by many, many, many people. Researchers who've never published a word about climate and health will be publishing the papers in the next year to 10 years. There will be areas of endeavor that we can't even predict right now because so few people have been engaged. There's so much that we don't know. The impacts that we're aware of are the most immediate and obvious and apparent impacts. They are not the impacts that for which you need to do complex study designs in order to identify them. And it could be that the impacts we don't know about are more important than the ones that are more apparent. For example, it's relatively easy to see heat-related acute illness, but it might be much harder to detect chronic illnesses that are caused by heat that evolve more slowly, but perhaps kill more people every year. And that's the kind of thing that I think inevitably is going to arise. The other thing that's happening then is that we all need to be willing to partner and not feel a sense that we own the field because of the fact that perhaps we or others, spent all their time working on this 5 years ago and others did not. But the others who did not need to be welcomed in. Many of them will become the leaders. Many of us will wind up stepping aside to allow that leadership to occur. We need this. There's a generational impact of this that is profound. And unfortunately, people in my generation did not prevent the worst consequences of climate change. People in the next generation and the generations to come are the people who are going to be responsible for shouldering the burdens around fixing things. And so, we as educators certainly play a role in that, as well as in doing that research, but we're not the only people who will be doing that. This education is going to need to occur across many disciplines and in many ways. And it's just very important that we partner in a very radical way to make this happen. That would be my response to that. Thank you, Lauren.
No, I might pile. Oops.
Oh, I'm sorry.
I'll pile on for just a moment because I think, Laura, a lot of the promotion of synergies, we will be looking, I think, to the ASPPH itself to help promote those and to be, the place that brings together people to talk, to develop best practices, to share protocols, perhaps to develop, multi-center research that can have both local and higher level implications. So I think we will. It's a big problem, one on which we all need to work together. And I think, having ASPPH put together the task force was just a very important step in moving the work together and create synergies among the schools and programs.
Thank you. Dr. Benjamin?
I think three things. One, obviously having ASPPH and the programs participate in some of the existing alliances like the Planetary Alliance, Eco America Alliance, the alliance that APHA has and others, I think are going to be very, very important going forward. I think the schools and programs have a very specific opportunity to be the subject matter experts within their universities around climate change and health. 8% of the carbon burden is borne by the health sector. And so as hospitals, universities begin to look at ways to reduce their carbon footprints, you can provide that expertise both through individual consultation as well as through your collective science as part of that process. And the third thing is the advocacy piece. Quite frankly, we need to get this funded. We need to get the research funded. NIH, as this budget grows, we need to divert more of that money into research on climate and health. We need to get core funding for offices like the HHS Office of Climate and Health for CDC's programs. Those programs must be funded in order to, build their sustainability over time. And we've got to figure out ways to do this in so that we get bipartisan engagement on this. And I think one of the ways to do that, of course, is particularly for those schools and programs that are in rural America, farmers, and rural America is now clearly seeing the impact of climate change on their crops, their farm animals, and the health in their community. And so we need to build coalitions with them through those schools. They have strong agricultural schools, they have strong veterinary schools, and those programs are partners, I think, that we can use to raise the visibility and get support, particularly from conservative legislators and conservative communities, to move a very positive pro-health agenda forward.
Thank you, Dr. Benjamin. Dr. Balbus?
I support everything that's been said. I would just want to point out a completely different kind of arena, synergies. We've seen something remarkable in so many ways over the last couple of years in the way that public health is held by society in the midst of a crisis. We thought we were very well prepared for a pandemic. We turned out to be well prepared in some ways, and yet there was a devastating crisis of mistrust, a devastating crisis of lack and failure of implementation that became really the primary emphasis for a lot of health and human services work, especially at the regions, to create these health equity coalitions and to figure out how do we regain the trust of the people who are most vulnerable. And I think we're going to be facing that at least as severely in implementing solutions to the climate crisis in various places around the country. Some places will be pretty ready, some places probably will be a little resistant. Some people will be ready, some people will be resistant. And I think that this is a fundamental issue of public health. I think there are a lot of different disciplines thinking about this issue of trust and how do we implement public health practices, in places that may not be so accepting of them. And I think that's an important area of synergy, an important area of implementation science, important area of research for us.
Laura, if I could add another point, and I apologize, but I think it also addresses one of the questions that we have in the chat as well. And that is a very common experience for me in my career around this issue has been that scientists and organizations, those who are concerned with biodiversity, the health of the planet, the ability, the survival of other species, have come to me, and I think some of my colleagues, as public health experts, looking to me at me as somebody who can provide validation. Their work is centered around biodiversity, but maybe public health can validate that this is also important for people, right? And I've been happy to do that because I do think that this is important for people. But I think it's also important that we have work that is centered around health and public health and centered around particularly the health of the most vulnerable communities. And that, we're not just providing validation in terms of, the doctors agree, the public health people agree that this is important, but that we are actually providing evidence that human health is impacted and that this evidence is going to be, I think, very critical to guiding policy, because moving forward, there are critical policy challenges affecting our country and the world that are going to impact health, depending on how people do that. How do you mitigate climate impacts? How do you adapt? And some of these strategies are going to have differential impacts on different communities. This has been where the environmental justice communities have come to the fore that, yes, you can overall reduce carbon emissions by doing certain things that might create more exposures in certain communities. And we in public health need to be engaged with centering our work around what's going on with the health of those communities to make sure that policies reflect justice and reflect really what is going to overall improve health. And so I think this is a major shift, even for those of us who have been, kind of engaged, but we haven't been able to be centered around health because there hasn't been the collective effort to do so.
Thank you, Dinkelman, for really answering the question and addressing the question about research and the priorities that we lay out in the report, and that you just answered it right now very well. And just to finalize, like answering some of the questions here, and then moving to the last question, maybe for this excellent panel, is that I just want to say to the audience that, of course, you need to, if you want to connect with us and engage with this important work, please write us and be connected, because we are right now organizing the next step, which is the implementation plan of this framework. So if you want to be engaged, please write to us and connect with us in order to be really engaged. And of course, we are also engaging with the other actors nationally and globally as well. So I would like to move us to maybe the last question, because I really would like to ask all of you the following. So in a year, 3 years, 5 years, what would be an indicator or 2 indicators in your mind that we are really making adequate strides on these issues?
I mean, take 3 things. A phenomenal increase in a number of peer-reviewed articles that are clearly in the literature that specifically focus on climate change and health. I think from my perspective on the advocacy front, substantial funding to support those efforts, both on the research side as well as the core practice engagement side. And again, CDC, Office of Climate and Health and Equity will be important. I think the third thing is that the community sees that the health and public health community are in their corner, that they see that we are making profound strides in providing the policies that people need to clearly address health equity and environmental justice problems in our communities.
Thank you so much.
I'll offer a slightly different perspective. I totally agree with everything that Georgia said. I would love to see indicators of success through the impact that the health community is having on the climate policy community. The UN Framework Convention on Climate Change, in its original inception, has a clause that says that every country that puts in a commitment is supposed to be analyzing their actions to assess the public health implications of those actions. It's written in the words. It's never been done. Nobody's ever been held accountable. Research shows that the actions needed to meet the Paris Agreement goals will create health benefits that, if you put an economic value on the health benefits, they outweigh the costs. That's a profound message that is completely, in my opinion, absent from the discourse that goes on around, for example, the COP27 meeting that's happened that doesn't have a health day. So I'd say, in 3 years, 5 years, if we had not 1 but 2 health days at every COP, that would be a good marker of success, and the impact that a expanded and energized and empowered health community could set as a goal, and also that at least a third of the countries of the world are actually paying attention to the health benefits of their climate actions.
Well, John, the downsides as well, if you look at the experts that have been brought together to discuss issues like carbon capture and sequestration, like geoengineering, you don't see health experts at the table. And, so technologies that are going to affect the planet in a profound way, perhaps to the benefit, by eliminating carbon, but what are the health side effects? What are the adverse effects? We know everything that you do is likely to have an adverse effect as well. And we have not been there, and I think all of us, and part of what I hope this effort will create, all of us, wherever we are, in our university, in our town, in our state, or globally, where you go, John, we need to get ourselves at the table. They need to listen to health.
Dr. Samit?
So just a couple of comments. I'm putting my dean hat on now. And I would hope that for the short term, we arrive at the right curricula for both those who are seeking general background, but those who want to take on climate and health as the area they're going to work in. And those programs might take a number of different guises, whether at the master's level or the doctoral level. And I think that's an important point for sharing. I certainly agree with George's that we need research. I think we need an integrated research agenda that leads towards actionable evidence. And I think we need to sort out what that is. And that's where the relationships among the schools and programs and many different sectors figure in. And we've done that in other areas. We've done that with air pollution, for example. And I think we need to have a similar approach here. So I would like to see more research launched, like to see it launched with strategic goals and application in mind. And the last thing I'd like to see is some of us, schools and programs, having successes in policy and advocacy and practice that we want to share with others, because I think, again, it's going to be the examples, the small things we do perhaps at the start that are going to be important to say, yes, we can get things done. So I'll stop there.
Thanks, Dr. Summit. Wonderful. So I would like to have the opportunity to give you like the last 30 seconds to each of you. What will be your last comment, recommendation, or just statement just to close our webinar today?
Well, let me just say that climate change is here, is impacting our health today, and it's an essential threat to our society, and we need to get on the work of doing this.
Absolutely. Dr. Balbus?
I just want to laud the association and say that we're at a time, from my vantage point, where so many people who have not been engaged on climate change and health are ready and willing. And I think that the creation of the framework is just a very, very positive and helpful step to getting everybody on board, to making this a very much an issue for everybody in public health. So thank you.
Well, thank you. Dr. Summit?
I think I'll just reiterate essentially what John just said, which is I think the framework is a very important step forward in having this platform for launching our collaborative activities, and really grateful to everybody who helped put it together, both the task force members and the ASPPH team. So thanks to everybody.
Thank you. Dr. Goldman?
Well, of course, I'm grateful, very grateful to the staff who are on with us today, Dorothy and Rebecca, as well as Laura for her leadership of ASPPH in helping us make this happen. But also, I'll note yesterday, Dr. Salmon and I talked to leaders from schools and programs and briefed them about this report. And there's so much enthusiasm across the country and in all regions of the country. And I think that one of the powers of the universities, our schools of public health, but other schools of health science, which will hopefully follow in our footsteps in this, will bring this work into many of the communities across the country that need it the most. So thank you so much, Laura, for helping to make this happen and for facilitating this session today.
Well, thank you all for joining us today for this important conversation. And I want to especially thank our panelists. You were incredible for contributing your time and your expertise with all of us. Thank you so much. This webinar has been recorded and will be available soon on the ASPPH website on the webinar event page. So you can also access the complete framework, executive summary, and other resources on our climate change and health page. This concludes our webinar. Enjoy the rest of your day. Thank you for participating.